A very good afternoon to one and all. On behalf of IIHP webinar series, I welcome you all on this platform. As you are aware, today we are holding our fifth event under IIHP National Homeopathic Missions and IIHP Webinars Committee. I, on behalf of IIHP Webinar Committee, once and again welcome you all to this event. Our last four events has been a grand success. Last week, we have listened to Dr. Ajit Kulkarni, and he has shown us the path to handle the acute cases in this COVID-19 era. So today we are again holding another session on management of thyroid disorders and PCOD, as you can see on the flyer. And our speakers today are Dr. S.V. Santosh Kumar, who is a Chief Homeopathic Consultant, Taha Medical Center, Abu Dhabi, and his colleague, Dr. Ehab Hassan Makki, who is a homeopathic physician and medical director in Health Medical Center, Abu Dhabi. So they have both been working together for quite a long time now. And Dr. Ehab Hassan Makki would be talking more on PCOD, but they'll be holding the session from a same location. So there would be no kind of break in between. So it would be a continuous session starting right from few minutes from now till around 6:40, and then we'll have a short question answer sessions. So as you are aware that IIHP is a only organization in India which is the organization only for qualified homeopathic physician and has been serving India for last 70 years, Indian homeopathy. And under the vision and able guidance of Dr. V.K. Gupta sir and Dr. M.A. Rao sir, our national president and president of honor, IIHP has now started spreading its wing to the international era also. And in that, IIHP UAE unit was formed, where a year before there was an event, beautiful event holded by IIHP UAE branch. Dr. Ritu Manchanda is here. I welcome here. And even in last seminar, we had Dr. Vinitha Shahani, who was a moderator into one of our seminar. And today again, proudly, I'm inviting Dr. Santosh and Dr. Ehab from IIHP UAE. So it is more of now international events we are holding. So both of them will be throwing light, and again I welcome you all and again invite you, those people who are not already a member of IIHP. I would invite them to join IIHP, because in this era we have seen there are so many other things than the practice we have to do. Enriching your education, raising your voice as a homeopath, and establishing our science in the mainstream. So that needs a lot of unity and lot of vision and lot of leadership qualities. So IIHP has many leaders in it, the people who have dedicated their lives for homeopathy. So if we join IIHP and make it a strong organization, then we can definitely enrich and take benefit of its services when we need it. So now I would invite Dr. Santosh to start his presentation. So are you able to share your screen? I'm stopping my screen. Now you can try sharing your screen, Dr. Santosh, please. So here along with us, I can see Dr. V.K. Gupta sir, who has been instrumental in upbringing the standards of homeopathy. Dr. Rao sir, Dr. Tanveer, and many of my friends from the south. So all of them silently working. Despite this lockdown, we could conceive this idea of webinars and we have materialized it. This is due to the vision and the dynamicity of our leadership that we can execute it in such a short time. So not taking much time, I would like Dr. Santosh. He has already started sharing his screen. So he will be throwing light on his work on management of thyroid disorders. Dr. Santosh. You please unmute yourself. Dr. Santosh. You please unmute yourself.
Can you hear me?
Yes, yes, you are audible.
Can we start, Dr. Singh?
Yes, yes, please start.
Thank you, Dr. Muktinder Singh, for a wonderful introduction. First and foremost, we would like to convey our sincere gratitude to the organizers of IIHP for giving us a platform to present a topic before you. Me and Dr. Ihab are together working for the last so many years. Today, the topic which we are going to discuss is the management of thyroid disorders and PCOD. I am going to share the management, homeopathic management of thyroid disorders. Especially, it's not possible for us to finish thyroid disorder as such in a one seminar. So we divided that one into two sessions. Today, I will discuss about the mechanism of thyroid disorders and how can we find a medicine for hypothyroid conditions in the patients. Along with that, my friend Dr. Ihab will go with the management of polycystic ovarian disease. Dear friends, we have already graduated from the homeopathic medical colleges, studying all the sciences in detail. After coming out from the college days, whenever we started practicing, we are trying to match the symptom similarity with the materia medica, ignoring the science which we have studied for the last so many years, as a result of which the acceptance with the scientific community for our system of medicine is not that much good. The practice which we are doing in India and the other part of the world is entirely different. The practitioners who are doing their practice in India are fortunate to dispense medicines from their medical center itself, so that even though we could not able to find a correct medicine during the first consultation, we could able to give a cell. And even during the course of our treatment, we have the privilege to change medicines. But other part of the world, especially in this part of the world, the rules and regulations of the health authority is extremely different from India. We are not supposed to dispense not even a single medicine from the medical center. We have to prescribe medicine, and that medicine has to be purchased from the pharmacy. The rule of the health authority is the patient should know. It is the right of the patient to know what medicine I am taking and the dosage also. So the prescription should be sure shot during the first consultation itself. And you know, now the technology, the world technology has also changed. Everybody knows, and they are coming with the knowledge which they are having. So if we are not connecting the science with the medicine, and they will ask, why doctor you prescribe this medicine? How can we, what is the function of this medicine? Everything has to be described in the detailed manner. Then only the acceptance will be there for our system of medicine. Whenever I started practice, it was very difficult, but now, because of our hard work, the number of patients has increased. Even the Arab people, you know, the mentality of the Arab people, whenever they take that medicine, before it reaches the stomach, they should get relief. But now they know the importance of case taking and everything. So what I would like to mention in this is, whenever we go for the seminar, even when we were doing the seminar, the doctors are coming for the tips. If you are giving some tips for the time being, that will be there with you. After that, it fades from our mind. Even Dr. Hanneman has explained in aphorism number 257, we are not supposed to go with the favorite medicine. But if you could be able to know the science and the techniques how to find the medicine, it will be lifelong. Here, I would like to quote one message. If you are giving a fish every day, we have to feed that particular person, giving fish. But if you could able how to teach him to fish, then it will be lifetime. Today, there are various techniques through which we could be able to come to a similima. Today, we are going to give you one technique, because with the pathophysiology only with the pathophysiology, we can come to the medicine in a scientific way. Let us start with the session. Before starting, I would like to take the blessings of our master, Dr. Christian Frederick Samuel Hanneman, who gave us a beautiful science, which gave us name, fame, money, everything. Thank you, sir. Next, what is the function of thyroid gland? Why thyroid gland is there in our body? What all hormones are there with the thyroid gland? And what is the function of each and every hormone? If we could be able to analyze each and everything in a scientific manner, we could be able to find medicine. I'm not going to give you the name of the medicines which we have been prescribing or something. If we could be able to get the technique, then even any doctors can find the medicine in a very easy manner. So the function of the thyroid gland, why body is having thyroid gland? Our body, 70% of our body is with water, that everybody knows. See, the brain is having 75% of water. Everywhere in the body is water. 70% of our body is water. Whatever food we take, whatever drinks we take, out of which 30% of the water which has been absorbed is only excreting through the various organs. Tears, saliva, sweat, urination, stool, 30%. The rest, 70% of the water has been taken for the metabolic activities of our body. So whenever we are taking this food, all the organs need this water. So water has been absorbed from where? Basically from the intestine. Which part of the intestines? Where the intestinal villi are very thick and heavy, there the absorption quality will be extremely high. So the large intestine will have thick and heavy intestinal villi, so that all the water, 90% of the water has been absorbed from the large intestine. Okay. So what is the thing which is pulling that water from the large intestine or from the intestine? This is what our thyroid hormones are doing. If these thyroid hormones are not there in the body, then the absorption rate will be altered, because all the metabolic activities need this thyroid hormones. So whenever the water has been absorbed from the intestine, it has been taken to the blood vessel. The fluid has been taken as a thick, heavy fluid, which has been diluted by, you need T3 and T4. T3 contains 3 iodine molecules and T4 contain 4 iodine molecules. Whenever 2 iodine molecules join together, the color will be bluish. Whenever 3 iodine molecules joining together, the color will be brownish red. And whenever 4 iodine molecules will be joining together, the color will be either straw color or watery color. So when whatever food we have been absorbed, whatever water has been absorbed as a thick fluid, it has been diluted by T3, triiodothyronine, and absorbed by the muscles, tissues, and the bones for the proper metabolism inside the body. The color of your plasma serum is brownish red because it contains triiodothyronine or iodine. What is the function of iodine in the body? Whenever we are getting some wound or something, what is the thing which we are applying? Iodine, isn't it? Betadine, everything contains iodine. What is the function of iodine? Iodine is the one which is for constructing the damaged tissue. So the main function of this triiodothyronine is to grow the muscles, organs, and the bones, because with the help of this iodine, protein absorption will be there. Protein will be taken inside, as a result of which the growth of your body has been done by triiodothyronine. I hope you are with me. So the function, the first function of triiodothyronine is for the growth of your general body. Then, what is the function of thyroxine? That is T4, triiodothyronine. So this heavy fluid, I already told you, whenever the absorption takes place, it will be as a thick fluid which has been diluted by triiodothyronine, as a result of which the muscles, like this pancreas, the insulin is like key to absorb the glucose inside the cell. Same function is there for triiodine. So whenever this muscles has been absorbed by this triiodothyronine and the iodine function is there inside the muscles, the excess fluid will be there. That has to be reconverted into a soothening material, because all the tissues, muscles need soothening for the proper functioning. So to make this one as a soothening material means it has to be deposited in the adipose tissue. For that, T4 is an essential component. Whenever it gets deposited in the adipose tissue, it is a loose connective tissue. Whenever this fluid, thin fluid reaches there, it mingles with the sodium. You know, sodium is there and becomes thick and heavy. Whenever this becomes excessive, sodium will be there and it is thickening of this one. This will be attracted by the acetylcholine. You know acetylcholine? What is acetylcholine? This is a neurotransmitter which transmits with the help of, you know, sodium, potassium pump, everything is there. This will transmit this one to the brain, as a result of which brain growth is there. So the proper function of triiodothyronine is to construct the growth of the body, and the function of T4 is to the growth of the brain. And what is the color of the cerebrospinal fluid? It is straw colored or white color or watery color, because it doesn't have serum. It doesn't have triiodothyronine. That is the reason why the color is white. Okay. I hope till now you could able to understand. T3's function, that is triiodine, is for the growth of the body, and T4 is for the growth of the brain. And what is TSH? TSH is thyroid stimulating hormone, because it is actually, it is a medium through which it is a storehouse of minerals, calcium, potassium, all the minerals with the vitamins are there in the TSH. It is a medium through which it is a transport. It is for the transporting this one to the other part of body through a medium which is called the thyroid gland. So thyroid gland or TSH is for the survival. T3 is for growth of the body. T4 is for growth of the brain. Okay. Now, whenever a child gave birth, comes out, immediately the thyroid gland begins to be activated. The first hormone which comes out or which becomes active is ACTH, adenocorticotrophic hormone, which gives the pain impulse. The child starts crying with that ACTH hormone. Whenever the cry started, which activates the thyroid gland, it sends signals to the thyroid gland. It sends signals for the hypothalamus to release thyroid releasing hormone from the anterior pituitary. Thyroid stimulating hormone secretes. Whenever this thyroid stimulating hormone secretes, then till now this thyroid is not functioning properly. Some pulse protein will be pushed inside the thyroid gland. when it reaches there, the cell starts relaxation condensing. Growth starts producing T3 and T4. This is the mechanism how first it starts in our body. For the first few days, I hope 7 to 10 days, T3 hormone is the one which has been circulating inside the body because growth of the body has been activated during the first 7 to 10 days. After that, slowly T4 comes into the circulation, as a result of which the brain function or the growth of the brain starts. Whenever it starts, which part of the brain grows first? It is the occipital part, hindbrain, cerebellum. As a result of which, the hind part, the back part, occipital part become swollen for the children. By 14 to 20 days, the child starts, whenever a stimulus is there, the child starts moving their hands, legs, everything. That means T4 functions there in the hind part. By 21 days, the intellectual parts begins to grow. And by 28 days, all the growth of the body along with the mind or the brain starts growing in a together manner, as a result of which we are performing cradle ceremony on the 28th day of the child. So the growth begins to start. If both the T3 and T4 has been releasing simultaneously within the first week of delivery, the brain tissue has not yet completely grown. So the electrical activity which has been occurred by these neurons, the brain cannot take that electrical activity as a result of which epilepsy will be there in the child for the within first few days of the delivery. The basic reason for the release of T4 is the BCG vaccine which has been given on the first day of the delivery. Whenever the BCG vaccine has been given, it tries to wash out all the toxins from the intestine and the respiratory tract, taking all the water from the body. Whenever almost all the water has been taken from the body, the peripheral everyone, the outside temperature will be less, so that the body will have fever. Whenever the fever comes, the body will try to pull more water from whatever sources it gets. So it tries to pull the CSF, which activates the thyroid stimulating hormone to release T4, as a result of which T4 is releasing in the first few days of pregnancy, delivery. This BCG vaccine is the culprit for the electrical activity of the brain within the first few days of delivery. I hope the webinar is very difficult to deliver this lecture because we cannot able to see what the viewers' facial expression is there, and the reaction also cannot be taken into consideration. But anyway, I hope you could able to understand the mechanism of TSH, T3, T4 hormones which is there in our body, so that we could able to go further. So in nutshell, T3, the TSH is the one which is the storehouse of which minerals, which transport that minerals to the different parts of the body. It is the very important hormone in our body. Then T3 is triiodotyrmine. It is very much important for the growth of our body, and T4 is very much important for the growth of our brain. That is what. Then we will go with the disease condition. The thyroid problems. The main problem which the people are suffering from is the hypothyroidism. Hypothyroidism means TSH hormone has been increased. I already told you it is the storehouse of minerals. Why TSH has been increasing? Inside the body, the calcium metabolism might be deprived. The function of the T3 is to strengthen the muscles and viscera. Whenever this function is going, the end product will be calcium. The calcium will be deposited inside the bone, the bones, outside or inside the bone covering. Whenever in the old age, the calcium deficiency is there, the TSH will take care of that. So inside the body, whenever we are having some deficiency in the calcium, either because of the less nourishment or because of the acceptance or because of the malnutrition, TSH will be more, so that it will excite the thyroid gland to secrete more T3, as a result of which calcium will be deposited inside the bone. If it is not there, excess TSH will itself increase the viscosity, the fluid medium inside the body. All the fluid medium will be little bit heavy. So there are 3-4 triads of hypothyroid conditions the patients are coming to us. Let us see how can we find the medicine for these 4 triads of hypothyroid patients. Whenever the TSH is high, and if the T3, T4 is normal, of course, whenever the T3, T4 is normal, that thyroid gland has to inhibit, has to secrete one hormone that is called TIH, thyroid inhibiting hormone, which sends signals to the hypothalamus, isn't it? So that thyroid inhibition will be there. Now, here T3, T4 is normal. Still TSH is high. What is the meaning of that one? How is the body and mind? T3 means body is working good. T4 means body is also active. Brain is also active. Isn't it? Then one thing is, whenever the fluid inside the blood vessels is thick, even the nerve centers cannot able to send signals also. The sodium absorption will be less. The inactivity starts there inside the body. And another thing is, whenever the thickness is there, the megaloblastic cells cannot be activated. So that, you know, the lifespan of RBC is 120 days. After that, again the RBC has to be produced. But if the megaloblast cell cannot able to produce this RBC, then chances for anemia will be there. So here the TSH is high. So what will be the nature of the patient? Patient mentally active, physically active, but because of the high TSH, inactivity will be there. Bones, what will be the bones? Bones will have extra calcium calcium deposition. So HB might be normal or it will be near normal. Here the TSH condition will be below 15 only. Body will become plumpy because excess work is not being taken. Here TSH is more, so that viscosity is more, so it cannot able to produce. So stagnation will be there. Body becomes obese. So whenever this inhibition is not being properly done, that means it cannot able to inhibit now. What is the repertorial language of inhibition? It is why inhibition is the inhibition means timid. So what all medicines can be considered in this condition? All the timid medicines which are taking care of this shelter. Another thing is, whenever a person is self-devaluated very heavily, that devaluation also will make them into high TSH stage. So I am in very timid stage. What all medicines will come? You have to find out. You have to increase the repertoire of this one by giving medicine and do your own research in that. Last time also Dr. Ajit Kulkarni has been telling this one. This is what I am giving. The researchers who are there in this field has to find out what all medicines will be coming in that one. So what all medicines will be there in this one? Calcarea, Nexvomica, Ignatia, even Beretta can come. Sepia. All these medicines will be coming in this category. So T3 and T4 is in a normal range with TSH higher level. Second one. This is the second triad. Here T3 is less. T4 is more. It is in the normal range. T3 less means how will be the activity of the person? T3 is coming down. So mentally the person will be okay, but physically the person will be weak. How will be the HB? T3 is low. So the HB will be low in this type of patients. They will be physically weak, but mentally active. So the muscles get shrinked. First of all, the patient will be lean, thin. Muscles get, even the intraocular muscle gets shrinked, as a result of which bulging of the eyelids will be there. The body bones will become widened because of the calcium deposit. They will retain water, and the later stage they can go to a plumpy stage. So weak physically, active mentally. What all means? Active mentally, but weak physically, cannot able to do any work. They will be, so animal remedies can be taken into consideration. Lachesis, Crotalus cascavella, Elaps, Epis, Sepia. Or animal type of plants like Cannabis indica, Cannabis sativa, Hyoscyamus, or mineral type of animals, Calcarea self, Kali carb, or Kali self. Any of these medicines can be, we have to find out the other status of the patients and can be taken into consideration. Then come T3 is normal. T4 is less. What will be the nature of this? Now you could be able to understand how will be the nature of this particular patient. T3 normal means the body activity is, physical activity is normal, but mentally they are weak, very weak. They cannot be able to perform any work. they will forget easily. They will hunt for the words in between. So, how will be the HB level? Like that of the first stage itself. HB will be either normal in this kind, because T3 is functioning. So HB will be normal. Physically, the person will be active, but mentally they are very weak. They cannot able to perform their work mentally. So what will be the nature of the medicines? While hearing this lecture also, I would like to hear it clearly, but it will take you to the sleep mode. That means over sleepy medicines like Nux moscata, opium, andim tart, andim ars, lycopodium, picric acid, nitric acid, phosphoric acid. Any type of these medicines can be considered in these type of patients. One more thing is there. Whenever T3 normal, T4 level is less, the tendency for you might be knowing the people will have blackish discoloration on the axilla, groins, or on the area where the fibrous tissue is more, because the activation of T3 and T4 is there. T4 is not that much required for the body, for the mind. T4 will be disintegrate into another iodine molecule which stimulates the melanocytes, making the deposition of this melanin on the adipose area of this one. So whenever you are seeing the patient with that one, you have to see whether that patient's thyroid levels are normal, or in most of the cases T3 will be low. In that cases, we are having medicines like antim crude, graphitis, midorinum, staphysagria, like that medicines are highly useful for that type of cases. Then these are the three triads. Then comes the fourth triad. T3 is less, T4 also is less. What will be the nature of the patient? Mentally, physically weak. HB will be very low. See, mentally and physically this patient is weak. Physically low, mentally weak. What will be the nature of the medicine also this patient? They cannot able to do any work. Mentally not active, physically not active. Very slow constitutional remedies can be used in this one. Very slow means Helleborus, Pulsatilla, Calcareous, Hyoscyamus, acid force again, picric acid, slow medicines. Most of the slow medicines can be taken into consideration in this case. So these are the four triads of hypothyroid conditions through which a patient present before us. So whenever you are going to see the result, you could be able to understand what will be the nature of this patient. If, for example, T3 is normal, T4 is low, you can ask that patient, you are sleepy, isn't it? Accordingly, you can go with the medication. Similarly, if the T3 is low, T4 is normal, you can ask, that type of patients will be highly extroverted or loquacious patients. They would like to talk much, like lachesis, Crotalus orders, or like that medications. So now I hope with this you could able to diagnose with the result itself what all medicines will be useful for you, through which you could able to come to the medicine. Now it is your turn, because why I am not going with the other hyperthyroidism and anti-Tpo, because everything will be confusing you. Now I will invite my friend Dr. IIHP for the explanation of the PCOD and its medication, and after that we will wind up. Thanks, and if you have any suggestion, any questions, you can ask by the end of the session. Thank you, Dr. IIHP.
Welcome, Dr. Ihab. So by the time Dr. Ihab started, you please type your questions from Dr. Santosh's session so that we can address. You can send it to the admin personally, or then we'll be compiling those and asking to Dr. Santosh. So welcome, Dr. Ihab. You please start.
Thank you very much, Dr. Singh, and thank you very much for IIHP for having me today. Polycystic ovarian syndrome is the most common female disorder. The most common female disorder, and there is millions and millions of the females with the polycystic ovarian syndrome. Polycystic ovarian syndrome means ovary with a cyst.
You have to keep your mic a bit nearer to your mouth. Your voice is not very much clearly audible.
Is clear now?
Yeah, better now, better now.
The polycystic ovarian, it means the ovary with the cyst. The question is that how many cysts? It's 1, 2, 5, 7. How many cysts around the ovaries? Minimum 12 cysts around 12 cysts. If you got opportunity to see the ultrasound, you will find tiny holes. These tiny black holes around the ovaries is the cyst. And if you calculate this, it goes more than 12 cysts. The symptom is very clear. Irregularity of the period, irregularity in the form of oligomenorrhea or amenorrhea, or abnormal uterine bleeding, acne on the face, or other part of the
sorry
body.
to interrupt, Dr. Ihab, but your voice is still not very clear. Can you do something to... You try without earphone. Try without earphone. Direct. Plug off from laptop.
Is it clear now?
Yeah, better. Better.
So the acne on the face and the other part of the body increase hair growth on the face and other part of the body, and the most important, the female hair loss. Normal hair loss of the female on the top, but in the lady with the polycystic ovarian syndrome, it is male pattern of hair loss. That means it start from vertex and move forward, or it start from this area and move backward, and it gives the M shape. Now, in order to treat, first we need to understand what to be treated. And our master, Dr. Samuel Hahnemann, in aphorism number 3, advised the knowledge of the disease. So in order to know what is abnormal, let us first to know what is normal. Assuming that today is the first day of menstruation. Today is the day where our female start to bleed. In this day, the hypothalamus in the brain release very important hormone, gonadotropin releasing hormone. This hormone trigger the anterior pituitary gland to produce FSH, follicle stimulating hormone. So on this day, the follicle stimulating hormone, it go all the way down the ovary and asks the ovary to make follicle. Follicle is the tiny cyst that contain an egg. Therefore, from day 1 to day 3, the ovary is very busy in making follicles. Every month, left or right ovary release around 100 or 200 follicles. Out of 100 and 200, only one develop, only one qualify, only one start to grow. The rest disintegrate and disappear. The ones that develop, the ones that grow, start producing estrogen. Estrogen is the most powerful female hormones, and it has various functions. The first function is the one that builds the functioning layer of the endometrium, that is the house where receives the fetus. And the most important function is it helps in maturation of the egg inside the follicle. And now we are approaching to date 8 and date 9. And the egg inside the follicles now is fully developed, is fully mature. And this is the time to get out from the follicle. And therefore, the anterior pituitary gland in this day release LH. And the main function of LH to rupture the follicle, and release the egg. The future of these follicles, after releasing the egg, it turns into a specialized structure, they call it yellow body or corpus luteum. And the main function of this to continue to produce progesterone. If the pregnancy and fertilization takes place, the uterine cells produce very important hormones, HCG, to support the corpus lobus to continue supporting and produce progesterone and estrogen. And that is the one which detected in the urine. If it is not, this corpus luteum start to collapse. The collapse of corpus luteum 10 days or 12 days after ovulation, it means decline of estrogen, it means decline of progesterone, and it means collapse of the uterine. It means collapse of the functional layer of the endometrium, which it comes out in the form of the bleeding. Now, the functional layers, the nature of the functional layer, it determines what is the nature of the bleeding of this lady. If the functional layer, it is very thin, so the bleeding is going to be scanty in case of persitilla, in case of phosphorus, sulfur. And if the functioning layers, it is very thick, so the bleeding is going to be profuse, long lasting, like in calcareous carb, ammonium carb, and those type of drugs. So this is the normal. This is the normals, what is going on in the normal females. Now, the question is that what is the cause of ovarian cyst? It means why is the egg remain inside the follicle? Why the egg is not getting out of the follicle in simple language? And who's responsible? Because this is the function of LH. LH is the guy to rupture the follicles. Is it there is deficiency of LH? Is there is impairment production of LH? But normally in polycystic ovarian syndromes, LH is more than normal. So it is not the problem with LH. Because in order to treat, we have to know what to treat. The most important cause is the insulin resistance. In order to treat, first we have to think about insulin resistance. Insulin resistance, as we know that is, insulin is the one that puts the sugar inside the cell. And if there is resistance, the beta cells try to produce large amount of insulin in order to overcome the resistance. And that it causes hyperinsulinemia. In some female, hyperinsulinemia, it triggers the ovary to produce more male hormone, testosterone hormone. And normally, the ovary produce small amount of male hormone, around 15 to 75 nanogram per deciliter. But in some women whose their ovary is very sensitive to insulin, start produce large amount of male hormone. And the male hormone is the one that cause acne, is the one that cause irregularity of the period, is the one that cause hair fall, and is the most important is the one that prevent LH to rupture the follicle. Is the one that prevent LH to rupture the follicle. With the result, the egg remains inside the follicle. So months over months, it will form polycystic. So now that is the scenario. In order to treat now homeopathic management, where shall I start? The first questions, the main problems is the elevation of male hormone. And the cause of increase of male hormone is because of insulin. And insulin is high because of insulin resistance. So how could I manage? The first question, what is the cause? Before we go to the cause, the aim of treatment, first we need to reduce the male hormone because it's the one behind the oldest scenario of the disease. And to improve the male hormone, we have to improve the insulin resistance. So we have to deal with insulin resistance. The most causes of insulin resistance, there are many causes, but the most causes is obesity, is stress. So in short, the polycystic ovarian syndrome that causing because of insulin resistance, behind this problem is obesity. Or it could be because of stress. And then what is the cause of stress? Lifestyle disorder. Now our female is very busy, working day and night, and they don't have, and they normally rely on the fast food. They don't have choice, especially here. And the fast food is very high with the calories. And that is why they put on weight. Stress is a major cause. Because stress, it causes elevation of cortisol, and cortisol increase food for containing sugar. So they start craving the sugar. And that is why they put on weight. And here, obesity is the result. So there is obesity that causes insulin resistance. Insulin resistance causes elevations of insulin. Insulin causes elevation of male hormone. Male hormone cause of polycystic ovarian syndrome. So what do we treat? That is important. Now, obesity related sugar reduction, there is group of medicine it comes. Calcarea, calicarb, lycopodium, phosphorus, sulfur, natramur. But before we start medications, we are here to share the technique. First of all, obesity. We know that obesity, when there is excess energy and the body doesn't need it, body converts this energy to fats and then store it in different parts of the body. And that they call it body fat distributions. The body fat distribution is very unique. It is same, the reaction. It is same, different people react differently for same stress. For same stress, the reaction of Belsitila is not the same reaction for calicarb. Similar things, the reaction of the body of store the fat is very unique. And we can use this for selection of the medicine. Now, what is the factors responsible of fat distribution? First, estrogen hormone in female. Estrogen hormone is the one that carries the fats and stored in the lower part. And that is the reason our female, the moment they gain weight, the first part getting bigger is the lower part. And that is they call it gynoid obesity. Another hormone is the male hormone, and that stores the fat around the abdomen. And that is the reason the male, a moment they gain weight, they find that is their stomach getting bigger. But the most important, the gene, because we are different because of variation of the genes. Every person's because of the gene. So the gene is unique of the fat distributions. This is android obesity in the abdomen. Now, so look and diagnosis. If there is entire obesity, the whole body obese, that means upper, lower, abdomens, there is group of medicine it comes. Calcarea, graphite, calicap. Look and diagnosis. Obesity, entire all. Abdomen and upper part, still there is group of medicine it comes. Lower part, gynoid obesity, like Barcitilla, phosphorus, natramur, lacasis. Now, there is few medicine I will share with you. Calcarea cap. Calcarea is the, we know that is the among the best medicine for polycystic ovarian syndrome. The patient presents before you, as far as the obesity, the whole body obese, the upper, the lower, the abdomen, the face, and the most important, present with smiling. And apart from that, is we know the functioning layers of calcarea is very thick. So the menses is profuse, long-lasting bleeding, very sensitive to colds. Another medicines, whole body obese that present before you, look and diagnose, calcarea. But in calcarea, you see the smiling, and here you see the anger. Calcarea cap born psychotic, so it means she's obese right from beginning. Whereas calicap born soric, she's thin, and later on she developed obesity. The lower part of Kali is always weak, so she will present with polycystic ovarian syndrome and lower part spasm. Calcarea, she walks slow, she talks slow, introverted. She talk fast, extroverted. Now, whole body obese, look and diagnosis is also very important. Parietal. We have parietal carp and parietal moor. The parietal force, we know that the mind is parietal and the body is phosphorus. So in phosphorus, the fat is stored in the lower part, is gynoid. Whereas in parietal self, the fat is stored around abdomen and upper part. Bofu is the best medicine for ovarian cyst. And the fat stored is very unique. It is only on the side. Only the side that is getting bigger. And a part of that is the burning pains at the side of the ovary shooting to the side as well with dysmenorrhea. Ammonium carb, it is very unique. Look and diagnose. She presents before you the upper and lower extremities very thin with very big tummy. And serious look, never smiling. After prolonged grief, there is some medicines develop obesity after long grief, like natramur. And natramur, she born sorry, she is thin, you can see the clavicle, you can see the neck. And the problem that is, because of prolonged grief, there is large production of cortisol. And cortisol increases the food containing sugar. And that is why start gaining weight is gynoid in the lower part. Tibia. Syria is considered among the best medicine for ovarian cyst. And we know Syria tall and slim with a narrow pelvis. That is, the pelvis is male characteristic. The female normal is wide pelvis for childbearing. For Syria is narrow pelvis, straight from shoulder all the way down. And what is the cause of polycystic ovarian syndrome in Syria? It could be insulin resistance, but there is another cause also. We know Syria is the ink from the cuttlefish. And this ink, it contains pigment. And the color of this pigment is brown, from which they call it sepia. Similar like silvers, it is basically the colors. They call it argentum, similar like gold. It is a color, they call it orium. So scientifically, it has shown that when this sepia ink enters inside the body, it's proven now what it does. First, it causes disorder of melanocyst, and that lead to brownish spot. And the most important, it causes reduction of estrogen. And estrogen is very important hormone for development of the breast and puts the fat on the lower part. And the most important, it causes increase of the male hormone from the adrenal gland. We know that the female produce androgen from the adrenal and from the ovary. And because of overproduction of androgen, it causes hyperandrogenism, and that causes acne, and that causes hirsutism, and that causes irregularity of the period, and that lead to polycystic ovarian syndrome, and that lead to infertility. So the aim of treatment, first, we need to improve the insulin resistance because it's the problem behind polycystic ovarian syndrome. To improve the insulin resistance, we have to treat obesity. We have to treat the leptin resistance. PCOS is the team that is include the nutritionist, include other specialty. It is a team. We need to put proper diet plan by qualified nutritionist, and then you prescribe your individualized medicines. Thank you very much. I think I will call Dr. Santos to continue PCOS with the thyroid.
Thank you, Dr. Ehab Makki. You have been very clear in explaining what you have been explaining. Despite some language accent and low voice, you have bound us all, and we have been listening to you. You have really thrown some light. Now I think Dr. Santosh will continue.
Dr. Muktinder Singh.
Yes, yes.
Yeah, can you note down the points which this doctors has been writing?
Yes.
Okay, the one thing that some doctors has been writing about was the once more they need the chart.
Yes.
Okay, that I will explain now. Before that, I would like to go nothing more. I would like to go with the importance of PCOD and hypothyroidism. Whatever Dr. Ehab has been explaining till now, everything is related with the obesity. So whenever the primary hypothyroidism will be there, that will increases the TSH secretion. That is what I already explained before. Then that also will increase the prolactin, which decreases the frequency of gonadotrophic releasing hormone, as a result of which the polycysts will be there inside the ovary. So whenever the patient comes with infertility, we have to go with the examination of thyroid hormones and this polycystic ovary. So the medicines which he has already explained, even this, see, whenever the increased THS is there, TRH will be there, then it will be increasing the TSH hormone, which will increases the adiposity. Because whenever the increased TSH is there, I already explained to you, TSH is the one which is the storehouse of the minerals of our body. And whenever increased TSH is there, that will increase the adipose tissue all over the body, especially on the abdomen, where the loose connective tissue and fatty layer is easy to get deposited, which will increase the leptin, which will increase the hunger. Same thing happens along with this autoimmune disorder. So this is what we would like to explain. And regarding the other factors of this thyroid disorders, why we are not giving everything in a one shot, because I hope most of the doctors might be thinking about the hormonal variations and other thing. Then now you can come with the medicines itself. We are not giving you the medicines. So now once more we will go with the slides which we have. Some doctors have been asking. Just wait for 2 minutes. I will just go with that one. This might be the slide which this doctors have been. Is it right, Dr. Muktinder Singh?
Yes, yes. Shortly, you can recap this slide.
Yes, just within 5 minutes we will recap, because the crux of our topic today is the hypothyroidism. So how can we manage that one? So whenever the patient is having high thyroid stimulating hormone with T3, T4 normal, the basic thing is whenever the T3, T4 hormone, that has to be stimulated, that has to be thyroid inhibition has to be there, which is not giving that inhibition. So whenever TSH is there, T3, T4 normal, the patient body will be either obese. The first thing which you have to do, whenever a patient comes with this result, TSH high, T3, T4 normal, and if that patient is lean, thin, then you have to think that this patient has been affected with this hypothyroidism recently, which has not accumulated the water or the fluid content. Minimum 6 months might be there for the TSH increase. So the body will become obese after few days. HB also will come down when the T3 level will be decreasing very fast. So medicines which are coming in this one is, what inhibition means? Timidity. The rapporteur means timidity. So whatever timid medicines are there, calcarea, somebody was asking about the bereta, bereta also can come. So that's why I'm telling, we are giving you some methods. It is very easy for you to find out the medicines from the materia medica itself. We are not going to differentiate the medicines and other thing, because medicines, everything is there in the materia medica. So this is the first group of patients who are coming to us. Second group will be T3 level will be less, T4 will be normal. We can, now itself we could able to understand what will be the nature of the patient with the result itself. T3 less means the body function is less. T4 is normal, mind function is normal. So HB will be less. Again, physical body weakness, mental will be active. So most of the animal remedies like lacasis, Elaps, Crotalus cascavella, Epi, Sepia, or animal-like plants, Cannabis indica, Cannabis sativa, Hyoscyamus, or mineral-like animal, Calcarea, Sulf, Kali, Car, Caliph. That type of medicines can become. Some other medicines also will come whenever you come with the treatment. So much of things we have got from our masters. We tried and we are now even in the trial phase. Then, whenever the T3 is in the normal range and T4 is less, What is the meaning of that? When T4 is there, the body is so weak. The mind is so weak. I cannot able to think properly. I will hunt for the words whichever I am telling. One more thing is there in some patients also, whenever the patient has been over dominated by either with the husband, with the parents, over domination from the office or anywhere is there, then these people also will have T4 less condition. Then another medicines will come. That is why the cause has to be taken into consideration for the treatment. So then come Lilium tigrinum can come, Clumbum can come, Beretta Moor come, because it is because of the over domination. Over domination means my level has come down. That is the feeling, self devaluation. Then in that condition, HB will be normal. The patient will be physically active. Mentally, the patient will be weak. So what are the medicines which is mentally weak? They are oversleeping medicines like Nux muscata, opium itself is there, antimatar, antimars, all these medicines can come. Oversleeping medicines. Then comes the fourth triad of the patient who are coming to us. T3 is less, T4 also is less. So the mind and body is less. Whenever the 3T comes down, of course, I already explained to you, whenever the blood vessel, the thick fluid is there inside the body, it won't allow the megaloblastic cells to become active. Then only the HB, somebody was asking what is the HB? HB is hemoglobin. Then only the RBC production will be there. So whenever the T3 is again coming down, that means body again become dull. So HB will be again low. Mentally and physically weak. That means very slow medicines. Calcarea is there, Helleborus, Pulsatilla. Here also Beretta can come. Picric acid, acid force, all weakness medicine, all the acids can come. So these are the medicines which can be considered in case if we are having hypothyroid condition. And the other conditions which have been connected with this one, autoimmune conditions are there, hyperthyroidism is there, that will be explained like this in the next class. That is what I would like to explain. Then along with that one, why we are going with this one for the last so many years, that also I would like to explain. Whenever we went for a seminar in Germany, that too the birthplace of Dr. Hahnemann, there in the Leipzig, there is a monument of Dr. Hahnemann is there. On that day, unfortunately, one protest was going on. That everybody should know about that one. That is why we are always telling that you have to go scientifically. Because whenever we go there, the protest was there. On that day, the people put a silver cap on the top of Dr. Hahnemann's statue. And they put a placard on the area. They are saying, we need science, we love science. What is the meaning of that? We have to think about, especially the youngsters who are coming out from the colleges. You have to connect our system of medicine is so scientific. Each medicine is scientific. So we have to scientifically explain, then only we could be able to get acceptance from the scientific community also. That is all. That we are not going that much deep. If you have any questions, you can ask that questions. And regarding potency, somebody was asking. Actually, I am practicing in Abu Dhabi and Trivandrum itself. In the Trivandrum clinic, I usually give 0/3 daily dosage. Because I already from the beginning itself, I told that we are not supposed to give not even a single medicine from this medical center. This is highly strict in our country. So here only one dose of medicines we will give, then we will advise them to re-dilute that one after 1 week. Because everybody knows this organon very well. Organon has to be studied in detail. In a force number 246, Hahnemann explained, you are not supposed to give the same medicine on the same dosage because the body won't accept that potency. So what we are doing, we will advise, because it's very difficult to explain to the patients also, because SL is not there, So we will advise them, take 30 ml of water, put 3 tablets in that one, then dissolve it and take 1 dose. 5 ml at night, not full. Next week again we will tell 60 ml of medicine, 5 ml. Then 120 ml. By that way, once in 15 days, 20 days we are giving and we are getting excellent results. In Trivandrum clinic with 0 bar, the cure rate is extremely high. That is what I would like to mention. And that credit goes to my close friend, Dr. Tanvir, because we both were studying for post-graduation in Punjab College. I got this idea from Dr. Tanvir Hussain, and I am so fortunate enough to use that one. And in my clinic, most of the doctors are using that one, which really gives us a very good result. Dr. Muktinder, any other questions are there?
Someone has asked about how to differentiate between the reports of free T3, T4 and T3, T4, F T3, T4 and T3, T4.
Actually, everybody was looking for normal T3 only, but free T3 is the thyroid hormone which doesn't change even with the pregnancy. So whenever we are having some other internal disease condition, metabolic disorders or pregnancy, there will be some changes in the normal T3 and T4 function, but T3, free T3 and T4 won't be changed. So that is the reason why most of the doctors are writing free T3, free T4. That's all. Any other question, Dr. Muktinder?
What about anti-TPO?
That is what, that we have not yet touched that topic. It is a very large topic that will be discussed during the next session. So much of things are anti-TPO, TPO. This is also a thyroid. This is not a parathyroid condition that we will discuss next time, so that we could able to come. Now our main object is to just try with these medications and the way which we have shown to you, so that you can come with some medicines. We will discuss. We can incorporate that medicines in our chest also. Okay, Dr. Riha? Any question regarding PCOD also? That also has to be asked.
About the blackish discoloration around neck,
Yeah.
joint, in T3 and T4. Can you throw some more light on that?
Yeah. So whenever T3 levels and T4 levels are normal in the body, or T4 levels are low, because you know how much will be the level of T3 in our body? It is 100, around 100. But T4 is 10 to 15 only. Why? Because the muscle fibers, muscle tissue, visceral tissues, everything needs more stimulation, triiodothyronine. That is the reason it is more. But the brain doesn't need that much of this one. So it is only less. So even though you know that T4 is the one which is coming out from the thyroid gland, it is thyroxine, but it is inactive form. It converts into triiodothyronine, which becomes active. Then whenever it converts into this triiodo or iodine molecule, differential iodine molecules, this iodine molecule will stimulate the melanocytes, which will be deposited in the area where the fibrous bands are high or adipose tissue is more. So most of the patients who are coming with that one, their T4 will be less, T3 will be normal, the TSH will be high. So you have to think medicine accordingly. Antimcrude, graphitis, medorinum, Staphysagra, all these, Calibicromica, all these medicines can come. Okay, this is the science behind that. Another question, doctor?
Yeah, there's another question about how to treat hirsutism, the facial hair in female only, without any menstrual irregularity, obesity, or thyroid diagnosis.
Thank you very much. I hope you understand my accent. Okay. Now, there are various causes. First of all, inflammation of the ovary. An infection of the ovary, it may lead to increase the male hormones, and that cause the hirsutism. So that is mostly what we normally do. We go for screen test, serum reactive proteins, ASR, that is indicate if there is inflammations, and accordingly we handle the cases. There is another conditions, another congenital gene problems that is involved in adrenal gland, that is they call it congenital adrenal hyperplasia, in which there is large production of male hormones, and it could be behind the hirsutism. So, but basically it's most likely because of inflammation of the ovary. We normally try to find the personalized medicines and try to find individualized medicines, and we prescribe accordingly. Okay.
So if there is a patient with primary infertility due to PCOD and thyroidism, hypothyroidism, how can we approach such a case?
Now, it's true, as Dr. Santoshi mentioned, because hypothyroidism, it will causes the PCO, polycystic ovarian syndrome, it could be caused because of hypothyroidism. So we normally approach to treat the hypothyroidism, because infertility is the secondary because of hypothyroidism. So we approach to treat the hypothyroidism, the technique that used by what Dr. Santoshi explained.
So what is the role of, supposing Dr. Hahnemann has emphasized a lot on lifestyle corrections and lifestyle role, because these both hypothyroidism and PCOD, they are related to lifestyle disorders, LSD.
It's
so
true.
how you consider that?
It's
in
true.
your patient?
As I have explained, that is the lifestyle disorders that causing obesity, and because of obesity lead to insulin resistance and eventually lead to polycystic ovarian syndrome. We focus in treating the obesity basically, because if we treat that once, definitely it will correct the polycystic ovarians.
So the people are asking many questions, but most relevant we have already asked you. So another question which has just popped up on the screen is that what about the allopathic medicine which patients are already taken?
Now,
and how you mix and match? But I know your UAE, the rules are different, but here in Indian doctors, they have more freedom to choose or to fine tune the medication. But there in UAE, you hardly have any liberty for that.
It's true. It's true. We cannot. Yes, there is a lot of restriction in using the conventional medicines, but in general, that is the most of polycystic ovarian syndrome. In most gynecologists, they use metformin, that is to improve the insulin resistance. But we very rare try to, because we normally focus on the cause. We try to focus to treat the obesity, basically. We never approach conventional medicines, because most of patients that try to consult us, they are running away from conventional medicine. We cannot prescribe even if it is allowed.
Right. So anything, Dr. Santosh, you would like to add to it?
Yes. Regarding the thyroid problem and whatever will be obesity.
On menstrual dysfunctions and thyroid, menstrual dysfunction and PCOD, you can.
So regarding the lifestyle disorders and other thing also, actually what we are telling to the patients, even in, you know, this part of the world is with full of lifestyle disorders, because people are not making food in the house, but now everything has changed because of the corona. But previously they were taking food from outside, as a result of which the adipose tissue or the obesity has been increased, which is the basic reason for all these things. Even our master Hahnemann has explained the causative factor, the maintaining cause, whatever is there has to be removed. So we are advising our level best to go for exercise, take this, reduce the intake of this food. Along with that one, we are giving medications. And regarding the medicines which they have been taking, most of the patients who are coming for this thyroid conditions, it's very difficult to get the result which I told you previously, because most of the patients might be taking medicines, metformin or other, the thyronome or other medicine for the so many years. So it will be very difficult. So what we are doing is, we will try our level best to find the previous first result which they were having. Most of the people might not be having that one, but some were keeping that track. Accordingly, we are starting the medicines. If it is not there, then we will slowly taper that medicine, giving our medication, slowly taper whatever available materials we are getting, taking the case into consideration, giving medicines. And so many patients, we could able to complete. I will show you the cases next time whenever we come forward, because today, whenever I was discussing about the mechanism, I thought the mechanism itself is a huge subject. So medicine and other thing we will discuss next time. Then the other thing is, slowly we will taper and we will completely avoid that medication. Completely we could, because we are treating the cause, not the effect. So we could able to stop the medicines. Regarding the menstrual irregularities and other thing, there are several causes for that one. One of the causes is this, but stress is another cause. Here we are working in a place where so much of work pressure is there. That itself is a repertorial language. We have to take into consideration the repertorial language. Take that one into consideration. Stress, it is not the disease with the thyroid also. It is the disease with the thalamus, hypothalamus. Another protein has been coming up. So we have to treat that one, not for the other one. There are so many patients who are coming with thyroid disorders, not only with the menstrual disorders only, nothing is there. That is, might be because of the stress which they are having. We will find out and we will treat accordingly. But frankly speaking, without giving medicine from our side, because no placebo is there. So we are prescribing, especially in Abu Dhabi. In Dubai and Sharjah, some doctors, they could able to give some medications. But in Dubai, Abu Dhabi is the head of UAE. Here the rules are extremely strict. So we are actually finding difficult, but still we are prescribing some biochemic, which is also having medicinal value. But we have to give some medicines regularly. Now, how can we give one dose of medicine for 1 week? Even there, 3 tablets only. After that, we are not supposed to take. How is it possible? So we have to give regular medication. So we are telling them every day take one dose of any biochemical. By that way, we are managing. Any other question, doctor?
Sir, see, I'm just taking a, people are eagerly waiting for your next session. Definitely, we'll be planning it very soon.
Yes.
So all will be informed of the new schedule.
Okay.
But I'm just taking a liberty to go a bit away from the topic. There are, on my personal phone, I have got some messages. People asking for scope of homeopathy in Gulf region and how they can, the students, is there any good career and scope of homeopathy? I know I'm going a bit away from.
No. This is common, doctor. Whenever we go for the seminar, so many questions have been asked. Doctor, first thing which I would like to mention is, we are fortunate to reach here during the first time itself, so that we could able to make our name here. Whenever the newcomers are coming, there are some bad experiences with the management. So some management has closed this center itself. So the chances for the job here, we have to go for a examination. Ministry of Health examination is there. It is very strict. First of all, you have to go for the written examination. Then you have to go for a viva examination, which will be another difficulty for to pass, because it is not the examination which has been conducted like in India or the whole examination has been monitored, video, audio. So nothing can be done. Even if we people are there in the interview committee also, we cannot able to do any help. So even after coming out from the examination, if, for example, if another person has come out from the examination, they have to find job in a clinic, which I hope now most of the clinics are not offering that one. But some clinics are offering. Even Abu Dhabi itself, they have completely stopped giving permission, license for the people. For the last 6 years, 7 years, not even a single doctor has come. But in Dubai and other part of the UAE, some doctors are coming. But first, they have to strive hard. But once you could able to come up with this one, then it's good. Because most of the people who are coming to us, if you are seeing my graph, 70% of the people are from India, Asians, India, Pakistan, Bangladesh, and anything. Another 30% only will coming from Arab. But in Ihab's case, most of the people are coming because as he is the only Arab personnel who is graduated in homeopathic system of medicine. So he is getting Arabic patients itself. So now the people are begins to come. So the job status is not that much good. We are trying our level best to make in the government sector also. We are working hard even during the COVID situation. You know, this is the first area where the COVID starts. We went for getting permission from the Ministry of Health and Health Authority. But unfortunately, you know the situation here, everywhere. Because first set of interview was over. They have taken all the details from and they are happy with that one. And they told minimum 4,000 to 800 people you have to give preventive. After that, whenever it goes to the higher session, it went off. So we are trying our level best. And we are trying to make opportunities for the people. We will do it. Don't worry.
Thank you, Dr. Santosh. Now, there are few questions in the chat about the recording of this and previous webinars. So all these are available on our YouTube official channel. I'll share the link in chat. You can follow the chat. I'll just after I stop speaking. So when Dr. Tanveer would be sharing his views about this session, so I'll be pasting a link of IIHP official YouTube channel. And all these recordings are uploaded before Thursday. On Tuesday or Wednesday, we usually upload it after editing it. And important things, I again, in the starting of the session, I definitely congratulate Dr. Santosh and Dr. Ehab both, because though being precise and short, but they have really pained the topic, and everyone is delighted with your explanations and even the scientific approach. So you are very right that you saw in the Germany and they are asking for the science. So even in this COVID era, we have realized the need of being scientific, having more evidence-based studies, developing our science at par with the modern sciences, so that we can just present ourselves in a stronger and scientific firm-footed way, so that when there is a need, we can definitely show what we are doing. So it is not that in the time of crisis we can do that. We have to make a plan. We are already in IIHP, we are doing the same thing. We have brought up some research methodology seminars, and even those people who are interested, they'll be given more chances to show their aptitude. So this way we can build up in next 5-10 years. We have to take it as a mission to establish homeopathy as the first choice of treatment. So I definitely would second your views that we should go scientific. Regarding IIHP, I was telling in the starting of sessions that IIHP is the only body of institutionally qualified homeopaths, and we have so many life members all over India. So I would I know today there are many people from the South India who have joined our sessions. So I would definitely invite you all to form the IIHP bodies over there. So you can contact us anyways, so we can guide you. Now I would invite Dr. Tanveer Hussain for his closing comment, and leave 5 minutes for the final announcements. I'll do that. So you can conclude your talk by 10 minutes. Dr. Tanveer Hussain.
Thank you very much, Dr. Mukhinder Singh, for conducting this very beautiful session. First of all, I would like to congratulate these two young batsmen, these Mr. Santosh Kumar and Dr. Ehab. I know these guys since a long time because Dr. Santosh was there with me in my house for a couple of days during our MD in Organon of Medicine. So I know the bent of mind of these two people. They are always searching for the scientificity statement, whatever is given on or behind the symptoms of the medicines, why this symptom has appeared in different materia medicas, how we can correlate it in the pathophysiological actions of the same medicines. So since long time I know these people, they are always looking behind the science of behind every homeopathic statements. So today's session, the topic which he was discussing a week earlier with me regarding the title and the topic. So he told me, Dr. Tanveer, we would like to share our topic in such a way that everybody will be so relished to, because most of the times we are only looking into the homeopathic part of the topic. But I really enjoy today's topic of both these guys because they have made so beautiful bridge between the homeopathic system and this modern medicines with all scientific and functioning of thyroid hormones, the function of T3, T4, TSH, because we know that in India only almost 32% of the population is suffering from one of the thyroid problems. See, the number of population, the number of people who are suffering from thyroid only in India is about 32%. So if we just understand the depth of this function, the functions in the symptomatology. So today I congratulate again because they have really justified with their topic very beautifully, very nicely, and not only this. When they were talking about this third aphorism, I always draw the attention of my colleagues towards the third aphorism of sixth edition of Organon, where Dr. Honeyman clearly says, he starts with this line: if the physician clearly perceives what is to be cured in diseases, because many of the doctors, they were asking to these two people how to approach this case, how to approach this type of case, how to approach this kind of symptomatology, how to approach this kind of diagnosis. Dr. Honeyman clearly advises us by giving the answer to all these questions is, if the physician clearly perceives what is to be cured in diseases, that is to say, every disease, it starts with knowledge of disease, indications. So we have to find the indications of every medicine in the patient. If we clearly perceive what is curative in medicines, what is curative in medicines? So beautifully today, these people, they have clearly identified the correlation between the pathogenesis of thyroid and the pathogenicity in the medicines. That is to say, in each individual medicine, knowledge of medicinal power. So if we understand the medicines in detail, in depth, what is the physiological action of these medicines, where these medicines they act, so we can wonderfully and can easily go to the right simillimum in a short spell of time. But in every case, we have to find the indications of the medicine in the patient. Because in the beginning session, Dr. Santosh has very clearly quoted one aphorism 257 of Dr. Samuel Hahnemann, 6th edition of Organon, because without indication, whatever medicines name these two people has given to us regarding PCOD, regarding obesity, the medicines regarding fertility and nothing, we should take into consideration all these things. But according to 257 aphorism, the true physician will take care to avoid making favorite remedies of medicines, the employment of which he has by chance perhaps found often useful, and which he has had opportunities of using this with good effect. If he do so, some remedies of rare use, which would have been more homeopathically suitable, consequently more serviceable, will all neglect. So people have shown you the path. This is not the only thing. Dr. Santosh many times quoted the statement, that's examples of medicines which are more useful in the treatment of thyroid or PCOD later on. But we have to find the indications for every case you want to treat. We should not be prejudiced only. So today's session, being a very scientific bent of mind of these two people, they have very beautifully justified with them, with the audience. Even if we get mastery over these two topics, PCOD and thyroid dysfunctioning, I think we can cover maximum area of our practice, because number of patients of these two diseases are coming like anything. They are increasing day by day because of the stress, the level of stress we are getting. Particularly this PCOD is so common in the young girls who are just before starting their career, when they are struggling hard for, they have so anxiety about this competitions spirit and all that. Many girls who are having examination stress, the stress about the future, the career, I have seen in my clinical practice also. We have shared this thing in various seminars. That these girls, they need very, very nice counseling as well. Not all these medicines are, we give the medicine, that is one part of this. Along with that, Dr. Santosh and Ehab, they thrown a very beautiful light over the lifestyle, how to make them. And regarding the counseling also, it is very, very important part if we try to give the treatment for these two diseases, particularly because it is all psychoneuroendocrinological axis which is affecting here. So Dr. Honeyman says in chronic diseases, if any person is continuously going through chronic vexation, chronic grief, chronic worries, anger, or any kind of stress which he is passing through, until or unless you are not able to take out that particular patient out of this stressful condition, you cannot cure him, you cannot treat that person. So he emphasizes, the homeopathic doctors, that you give your counseling regarding this religious backgrounds also. You try to convince the people regarding how to come out of the stress, whatever they are going through or whatever they are passing through. So it was very nice and very wonderful session, Dr. Santosh. The credit goes to both of you, and I hope that in your next session also, in the upcoming session also, you would do the same kind of justice with the topic. And along with this, I thank you both of you. The audience which is here, I also thank this audience, because they are always with us. They are giving us qualitative and quantitative time. Dr. R&Y, I'm seeing there are so many senior homeopathic doctors are attached with us. From Dubai, many people I could notice, Dr. Vanita Sahani, Dr. Ritu Manchanda, Dr. Fatima, other people. From overseas also, I could see many other doctors also. Dr. Sapna from USA, she is also attending this seminar. I was looking at her. So I thank one and all, and especially to our doctor, respected Dr. V.K. Gupta sir, Padam Shri Dr. Gupta sir. I really thank him, because he is always instrumental to organize all these things, because he always guides us, along with Dr. respected Dr. M.A. Rao sir, the national president of IIHP, who has given this wonderful platform for all of us to discuss. It is so nice to listen, very, very important and very informative webinars. So thank you one and all. Thank you very much, Dr. Santosh and Dr. Ehab, for wonderful session. Thank you very much. Thank you. Over to Dr. Muktinder Singh. Over to Dr. Muktinder Singh ji.
Thank you, Dr. Tanveer. So we are at end of this session. Dr. Tanveer has really put a special tadka of organ into the presentation. So now it is a pure homeopathic curry. So we'll be announcing the new dates and through the poster. So I am seeing many new faces joining us. So for that, you those people who want to join IIHP, they can call any of us, because there is a website of IIHP where you can get details of all the state units. Dr. Sudhanshu Arya is beautifully organizing and very elegantly putting up that website for all of us. So I definitely will take an opportunity to thank many people, starting from Padam Shri Dr. V.K. Gupta, Dr. M.A. Rao sir, President, Dr. Mahesh Pagdala. I can see his smiling face. He has been instrumental in organizing the events in Hyderabad. So student in and around Hyderabad can contact him. Dr. Srinivas Lulu has been our financial person into IIHP, and all CEC member of IIHP, Dr. Shivamurthy, Dr. Prabhakar Rao from Delhi, Dr. Geeta Mungia. She has been always been in a leading role in organizing IIHP events. So all these people who have been, Dr. Hegde, who was a speaker also in the previous seminars, he has been instrumental. So all these beautiful people, those who have contributed their life for upliftment of homeopathic system of medicine, there are many names who are missing. In Punjab, we have Dr. Rajesh Sofat, who is our president, Dr. Chandok sir, Dr. B.S. Chandok, who is a national advisor also from Chandigarh. So there are many people. I can see some people from Himachal also in the attending the webinars. In Haryana, Dr. Vinod Sangwan and Dr. Harprakash Sharma have been very supportive to IIHP. So all these beautiful people, I really thank, and special thanks for Dr. Santosh Kumar and Dr. Ehab. Dr. Ehab is really getting so much appreciations in the chat. Our senior Dr. Chandok is appreciating Dr. Ehab. So these blessings and all these associations at international levels, as because I would thank this Corona era for giving us this idea of webinars, and we all from different parts of world are sitting together in right from our own comfortable home, and we are just like joined as if we are sitting in a seminar room. So thank you one and all. So we'll conclude this session now. The recording would be uploaded on IIHP official channel. I have already shared the link. So thank you all for this beautiful evening spending with IIHP Webinar Committee on behalf of IIHP Webinar Committee and IIHP CEC Committee. I thank you all for being with us. Here we end the meeting. So next announcement would be again shared with you through the social media by the new poster. So maybe we'll be changing the platform from Zoom to again WebEx and Cisco, because we already purchased this for a month. So now this month would end. This was the last Sunday. So next we'll be changing the platform. So with that, I log off and thank you all once again.
Thank you. Thank you.
Thank you, Santosh. Thank you very much.
Okay. Thank you.
Thank you.